State Medical often has meetings up there, so I get to go. Paddleboard is as close I get to being on top of a moving object.
Madam Chair.
Hello, how are we
Hi.
doing on our quorum?
We do have a quorum now. There is 4 voting members that have joined us.
Oh, this is wonderful. All right, and it's just 1:31 and just turned into 1:32. We are right on track. I will go ahead then and call the meeting to order. And welcome everybody, and go ahead and ask you to take roll call. Thank you.
Thank you, Dr. Jameson. Russell Cook for the record. Dr. Florence Jameson.
Yes, here, present.
As present. Ms. Valerie Clark.
Present.
Right. Ms. Levon Lewis. I will mark Ms. Levon Lewis as absent for now. Dr. Sarah Friedman. I will mark Dr. Friedman as absent for now. Mr. Jonathan Johnson.
Present.
Ms. Amber Torres. I will be marking Ms. Torres absent for now. Mr. Quincy Branch.
Present.
Wonderful. I will now proceed with roll call for our ex officio members. Ms. Stacy Weeks.
Present.
Okay, thank you. Commissioner Scott Kipper.
Here.
Thank you. And Ms. Ginny Hilton.
Here.
Wonderful. Madam Chair, roll call is complete with 4 voting members present.
Excellent. Well, we'll just get on with business then. I would like to first ask for you to request if there's anyone who would like to have public comment.
Madam Chair, Tiffany Davis for the record. I would like to be able to assist you with the public comment since there's been some added language that we need to use in doing this. So for public comment, I would like to remind those who have joined us online that if you would like to make a public comment, if you could please raise your electronic hand feature, or please indicate in the chat box that you would like to make a public comment. And then Caitlin will go ahead and call on you and let you know when you may unmute yourself when it's time. And then also for those who have called into the meeting, if anyone has called via the telephone, if you would we'll let you know when you may unmute yourself to make your public comment. But to get us started, I'd like to start and ask Cassie, who is in our Carson City conference room. Is there anyone in our conference room that has public comment to make, Cassie?
Cassie Fuentes for the record. There are no public comments here in the Carson City office. Thank you.
Thank you, Cassie, for confirming that. And then online, if any attendees once again would like to provide public comment, you may at this time raise your electronic hand feature and Caitlin will call your name. So to allow you to unmute yourself and make your public comment. Do we have any public comments on our Zoom feature? And Caitlin, if you could please confirm for me if you see any hands.
Hi, Tiffany. Caitlin Blagan for the record. I do not see anybody's hands raised or anything in the chat.
Okay, thank you so much for confirming that. And then if you've called in on our phone line, if anyone calling in would like to go ahead and unmute yourself at this time and provide public comments. And maybe Caitlin, you can verify if we do have anybody on the telephone as well.
Caitlin Blagan for the record. I do not see any hands raised for the telephone.
Okay, I'm not hearing anything as well. Again, just one more opportunity. If anyone has any public comment, if you'd like to go ahead and unmute yourself at this time and provide that. Okay, not hearing any, Madam Chair, there are no public comments at this time.
Thank you. Okay, Florence Jameson, and we are moving on to approval of the minutes of the February 2024 board meeting. Having reviewed them, I did not see any corrections, errors of omission, or concerns. And have anybody had any concerns about them? So I would entertain a motion to pass the minutes from Tuesday, February 2024.
Jonathan Johnson, motion to approve the minutes from February 20th, 24.
Valerie Clark, second.
And before we'll do the vote, was there any changes that anyone wanted to make or any discussion of the minutes? Hearing none, we'll go ahead and take a vote. Everybody in favor can say aye.
Aye.
Aye. Anyone opposed? Anyone abstaining? It sounds like those minutes are unanimously passed. And now we get to one of my very favorite parts of the meeting, which is our executive director report. And I do want to compliment you on your report. They just become more and more organized, allowing all of us to follow on each of the issues so very well. So I will go ahead and ask our CEO, Russell Cook, to present his executive report.
Thank you, Dr. Jameson. Russell Cook for the record. I did want to remark before I read my report that I was just notified that Ms. Amber Torres has joined us. So unless there are any objections from the board members or DAG, I will be marking her present for this meeting.
Thank you.
Hey, Russell, can I just say one thing? You're very hard to hear.
Oh,
Is anyone else having trouble hearing you? Is it maybe it's me?
No trouble on my end.
Okay, maybe it's on my end.
I'll try and speak as clearly as I can, and I'll try and
Oh.
direct my voice to the microphone. Does that seem better, Ms. Clark?
Much better. Yeah, thank you.
Okay, great. I will project. All right. In the interest of time, I'm going to skip over the purpose, which is unchanged. It's always the same, and the table of contents, and I'll jump right into the general comments. The 4-month interim. Oh, and before I begin, I just wanted to remind the board about the new format for this report. We will be pausing after each section for questions, comments, and discussion from the board. So if you have any questions, please hold until the end of the respective section, and I will pause to entertain those at the end of each section. The 4-month interim since the February board meeting has provided an important opportunity for reflection. I've spent a significant amount of time reviewing past board meeting agendas and recordings from the pre-pandemic era up through the past year, and one conclusion seems evident. In recent years, the Exchange's board of directors has not been included in the day-to-day operational decisions of the agency to the same extent that they were previously. Certainly, this shift can be attributed, at least in part, to the overall maturation and stabilization of the Exchange as a state-based marketplace. It's also apparent that the change from monthly board meetings to quarterly board meetings had an impact on the scope and impact of the board as a decision-making body. But it's my belief that even in light of the quarterly meeting schedule, the board can and should be kept more proactively apprised of current and future Exchange activities. Having been faced with no shortage of urgent, high-impact decisions since assuming the executive director position last August, many of which have boiled down to choosing the least bad option, I can say with frank honesty that I would welcome a degree of shared accountability. One example, which I think illustrates this point particularly well, involves a vision carrier who approached the Exchange last year seeking a partnership. To provide the appropriate background context, the Exchange, like all ACA marketplaces, does not sell vision plans through the Nevada Health Inc. website. We have, however, maintained a relationship with a vision carrier called VSP Vision Plans for several years, which involves endorsing them as a trusted partner alongside the various health and dental carriers listed on our website. VSP pays an annual fee to the Exchange for this endorsement. I have to admit that when I first learned about the nature of this relationship, I felt some ethical reservations about the Exchange endorsing the services of a carrier over whom we have no regulatory purview and whose operations, including their customer service activities, are opaque to us. This type of relationship is not unusual, however. Most state-based marketplaces have a similar relationship in place with one or more vision carriers. And at any rate, I had no intention of trying to modify an existing contractual relationship. But these concerns were top of mind when reviewing the more recent request from the new vision carrier last fall, who was seeking a similar arrangement. I was especially sensitive to the idea of an endorsement because the exchange had recently dealt with the fallout from Friday Health Plan's court-ordered exit from the marketplace, which resulted in thousands of Nevada HealthLink enrollees losing their existing coverage. The exchange was criticized in the media for having endorsed Friday Health Plans as among the 7 Nevada health insurance providers offering the best health plans in the state. And we were criticized again for removing their logo from our website after Friday was decertified, omitting any mention of the insurer that the exchange had previously praised. So we approached the proposal from the new vision carrier with a fair degree of caution. Our first priority was to assess the performance of this carrier by reviewing customer feedback. During a phone meeting last fall, their director indicated to us that they receive only a few consumer complaints each year, and those complaints are generally resolved quickly. However, when we looked this carrier up on the Better Business Bureau's website, we found many dozens of consumer complaints from 2023 alone, the vast majority of which had not been resolved. One common complaint was that consumers were consistently unable to reach a live agent in their call center. Several of our staff members, including myself, attempted to contact their call center on multiple occasions over a 1-week time frame, using several different phone numbers obtained from the websites of other state exchanges who partnered with this particular carrier. We were unable to reach even a single agent. The results of this investigation convinced the exchange's administrative staff that a partnership with this carrier would not be in the best interest of our consumers, and that the public reputation of this carrier presented a risk to the exchange's status as a trusted source of high-quality insurance coverage. We notified the carrier of our decision, and we invited them to attend our February 2024 board meeting if they wished to address the board directly. We also mentioned that if the carrier was able to make notable progress in resolving their apparent customer service deficiencies, that we would be willing to reconsider our decision. They did not provide comment at the February meeting, and we've had no correspondence with this carrier since then. I have no reservations about the due diligence that we conducted or the decision that we reached. But today, with the clarity of hindsight, I believe it was a misstep not to present this issue to the board for a vote. With that in mind, I am resolved moving forward to improve the inclusion of the board as a decision-making stakeholder. This is the spirit which informs the remainder of my executive director's report, starting with an overview of the operational milestones that the exchange must accomplish before the October board meeting. I will now pause for any questions or comments from the board. Commissioner Kidder.
Couple questions on the issue around the other, well, about VSP and the endorsement. The report mentioned that receive a fee or an endorsement fee.
That is correct, an annual fee, yes.
And how much would that fee be?
I don't know off the top of my head what the VSP fee is. I have not reviewed that contract recently. My recollection of the proposal from the newer insurance carrier that approached us last fall was that the fee would be on the order of $5,000 per year. And
is the endorsement based on a level of any quality measures, or is this just a pay-to-play type of program?
That's an excellent question, and I cannot speak on the historical nature of the agreement with VSP, but the questions you raised were central to our consideration of the new proposal last fall. And in fact, our reservations along those lines contributed to our decision not to enter into a partnership with this insurance carrier. The lack of insight and the lack of accountability specifically.
Right, thank you.
You're very welcome.
Were there any other questions or comments from the other members?
Madam Chair, I have a
Ashley?
question.
Mm-hmm.
So is the VSP arrangement, when did that start?
My understanding is that started either in plan year 2020 or plan year 2021. But again, I apologize. I have not reviewed the contract. I would be more than happy to provide a follow-up email to the board with both the begin date and the expiration date of the contractual agreement, as well as the specific dollar amount per year desired.
Okay. And then just to be clear, it was the VSP that approached the exchange to create this relationship. It wasn't that you circulated like maybe an RFP to all the vision carriers soliciting information and advising them of a potential relationship. And
I'm not
also,
sure.
I have the same question about dental plans as well.
So it's my understanding that there was never a solicitation involved, or within the insurance carrier partnerships. And again, I was not involved with the sort of brokering or negotiation of the deal with VSP. I only became aware of the nature of that agreement after I assumed the executive director position last August. But as far as the newer vision carrier who approached us, there was no solicitation involved. I can confirm that. They did approach us, voluntarily of their own volition, and worked with the exchange leadership. I believe we were first approached in the late spring of 2023, but the exchange was absent an executive director from May until my appointment in August. So I could have picked up the project from there.
Okay, and then we don't have any relationships where they pay on the dental side, do we?
No, to be clear, every single insurance carrier, both health and dental, who sells plans to the Nevada Healthing Marketplace receives a monthly invoice for what's called our carrier premium fee. That's the sole source of the exchange's operating revenue. So they do pay a premium fee for the opportunity to do business on the Nevada Healthing Marketplace. But I would not characterize that necessarily as a pay for play type of an operation, or at least not a paid endorsement. There's no, as far as endorsements are concerned, all health and dental carriers are on equal footing, through the Nevada Health Marketplace. I hope that answers the question, though. If I missed
Yeah.
that.
I'm just trying to get in my head, what's the process for choosing a carrier? And medical, I understand, is probably different because we're more limited in medical carriers, but there are a significant number of dental and vision carriers on the marketplace. So I was just trying to understand how you choose the ones that you put on the website. That's all.
That's an excellent question, and I'm going to speak to the areas of this process that I feel comfortable that my expertise is
Sure.
appropriate. I may have to defer to our plan certification manager. Certainly, the Division of Insurance plays a central role in this process, but it all begins when insurance carriers who wish to enter the marketplace submit a form called an intent to sell. Typically, that form is circulated in February and March of each year, and I believe the deadline for submission is roughly the end of March of each year.
Okay.
So insurance carriers who are not currently selling health or dental plans to the Nevada Healthing Marketplace, but wish to begin doing so, that's how they start the process. There is a DOI review component. And then, of course, the exchange has a kind of a stringent process for reviewing kind of the minimum qualifications of the insurance carrier. They must meet minimum financial qualifications. The plans they sell are subject to, plan design, benefit standards, network adequacy standards, and then the insurance carrier organizations themselves must complete a robust electronic testing and onboarding process. So they must be able to interface with the exchange system. They must be able to perform enrollment reconciliation on a monthly basis. And, they must complete a comprehensive 3-month-long suite of test scenarios designed to emulate real world types of operating conditions. So again, hope that answers the question. Happy to provide more detail if not.
Yeah, no, it does. And it's actually very timely that we would be talking about bringing the board more proactively into some of these things, because actually I've been on this board since 2015 and I never really understood how that was done. So it'll be nice to maybe have some of these things brought to our attention more proactively so we can, just be aware. Thank you.
I appreciate the feedback. You're very welcome. And that is precisely the intent of the next section of the report, which is a 4-month look ahead. 4 months because that's the interim between this board meeting and the next board meeting. It'll be a 2-month look ahead in October, that sort of thing. But, it really was a goal of mine to provide a forward-looking and inclusive update so that the board was aware of events before they actually happen. So we're not just providing retrospective updates.
Russell, just before you go on, another brief request. I do believe you did an excellent job of vetting out this candidate to be on our website for endorsement. And since, as Valerie pointed out, some of these things were done in a different way prior to you coming on. And we really understand a little bit, and now even more, about the process for actually carriers. This other issue where someone just wants an endorsement, we probably should have just as a rigorous process written out that we go through for anyone we do endorsements for. So that would be wonderful if you can consider before the next board meeting, number one, to develop a process for vetting anybody who might be endorsed and bring that back to discuss with our board. And number two, this other person, we are all assuming that they were vetted out properly, but we really don't know that. So since none of us seem to be familiar with the people that are currently on for visual referral, perhaps it would be a good idea for you just to do a little retrospective review with them and see if they would if they would qualify under the new process to be endorsed by the board as well, to be on the website and for our clients. So I would really appreciate that. And would the rest of the board like to see that? Okay, it sounds good.
Madam
Yeah,
Chair,
Mm-hmm.
my apologies for the interruption. I just had saw it earlier that Stacy Weeks had her hand up, so I just want to make sure to see if
Oh,
she's.
I couldn't see
question.
that. My apologies, Stacy.
okay.
Please, Stacy.
Me too.
Okay. Who's doing the hand watching? Because I only see 4 hands on my field.
So thank
I apologize. I'm not seeing any, but Ms. Weeks, I'd be happy to hear an
Yeah.
answer.
in my question. So I appreciate, like, I'm, been in my role 2 years. I get you don't, but I would assume someone on your staff can share with the board exactly. Like, this is in addition to being certified on the exchange. That it's sort of a, and
You're
Stacy,
cutting in
kind
and
of
out.
breaking in and out.
I know. So just read my post and that will do it. Thank you.
Thank you so much,
My-
Stacy. I agree.
My question, I understand with medical and dental plans, there's a specific certification criteria process that they have to go through to be listed on Nevada Health Link. But when it comes to vision plans or anything else that may come up in the future and these endorsements that are solicited, first question is, do we have any other arrangements like that outside of medical and dental that's run through that standard process on the exchange that you're aware of?
Well, to be clear, I wouldn't say that we have kind of a standardized review process per Dr. Jameson's suggestion a moment ago. And I really wished we had one last fall because we kind of had to make it up as we went along. I do think that this would be an excellent candidate for a written policy and procedure that we could publish on our website, so that we have something, in the way of objective, criteria. And I would welcome involvement from the board to make the final, to be the final arbiters of who receives, the endorsements for Nevada Health League. But if I'm understanding your question correctly, I am not aware of any other entity, insurance carrier or otherwise, besides VSP Vision Care, who currently maintains an endorsement from the exchange. And as I mentioned earlier, but I just want to clarify, we do not endorse per se any specific insurance carriers that offer health or dental plans through the Nevada Health website. We do kind of implicitly endorse them insofar as they're not allowed to sell plans that don't, that don't meet the standards of our rigorous plan certification process, which is conducted in close collaboration with the
But to that point, right? Vision isn't one of those that have to meet a particular measure or definition or standard, right? And so when it comes to some of these things that are outside the purview of the exchange and its intent, what is the objective? What is our role? And that's really where the question comes in. And then just given this recent experience, are there any other arrangements in place that we need to be aware of?
Yes.
Nothing comes to mind. So I didn't mean to cut you off, Dr. Jameson. Did you have a comment?
No, I was going to say very understood. So I'm looking forward to your feedback. I just had one last comment on your on the first subject, which was I really appreciate you recognizing and using this example. And even as I reflect back, the couple examples you used, the one in writing and the one you talked about earlier, with you mentioned Friday, going through that almost on your own without enough feedback from us perhaps, and we could perhaps have helped you feel more confident that you weren't going to take any missteps through that. So there was a couple of good things. You know, when we first started, many of us remember 10 years ago that all of us were working board members. We were a part of committees, and that's how entities start. And then eventually, when we hire incredibly competent people such as yourself and everyone on this conference call right now, the pendulum swings the other way. And we try not to be a micromanaging board. We try to have faith and confidence. And now that the pendulum was, you know, swung where we used to be a working board and then it swung all the way other way, your suggestion of finding that middle ground is beautiful. And I compliment you and appreciate. And thank you for inviting us. You may get a lot more input than you desired. So thank you so much.
Dr.
Careful what you
Jamison,
wish for, right? I'm sorry, Tiffany, go ahead.
I apologize for continuing to interrupt. With both of your permissions, if you wouldn't mind, I wouldn't mind tracking the hands, electronic hands for when board members make comments if they do raise them. And I would just like to read Stacy Weeks, since it's the appropriate time to do so, her comment that she put into the chat for anybody who may have called in and is not able to see that, so that they know what all comments have been made. So she wrote in the chat, "I appreciate that you do not have the information, but can we work with your team to share with the board on what criteria you used to use? That would be helpful. Also, are there any federal requirements that apply to what we should be using to guide the Silver State Health Insurance Exchange endorsement?" So just want to make sure that was clear for all attending to hear.
Thank
I
you.
appreciate
That may
Tiffany.
help us from having to recreate the wheel if there's already some federal guidelines. Thank you, Stacy. Russell, I think we're going to let you go on to the next paragraph.
If I may, if it pleases the board, I wanted to acknowledge what I think is an excellent point that Ms. Weeks made, which in my mind connects directly to a question that the question that Mr. Johnson raised. So I just want to kind of close the loop on that one. We looked into federal requirements last fall, and we were unable to. In fact, we reached out to CMS for guidance, and we are not aware, based upon that work, of any federal guidelines that apply to these types of endorsement, types of deals. In terms of, what kind of structure we can impose potentially around those types of arrangements, these are organizations, again, for which the exchange itself has no regulatory purview. The Division of Insurance certainly has their purview. But in particular for us, we would be concerned about customer service levels and having some insight into consumer complaints, that sort of thing. That's what I meant when I used the word opaque or opacity in my report, is that we just don't have that level of insight. So one possibility that had occurred to me, kind of in the tail end of our process last fall, was that, if we could develop a policy, and if that policy, if one of the minimum requirements for endorsement, aside from meeting certain criteria about, current existing performance, existing customer service levels, that sort of thing. But if we could require perhaps a quarterly report or maybe even a semi-annual report from these carriers in terms of consumer complaints, performance metrics, essentially key performance indicators that could be utilized to track their performance and then share that information as part of our board reports. I think that might be a really good start in terms of a structured approach to these partnerships. Clearly, and I think every state-based exchange out there that maintains such a partnership will tell you that there are benefits to these partnerships. What I am primarily focused on, and what was the primary focus of our decision-making process last fall, was risk management. So I think somewhere between the risk management versus, providing additional options to our consumers, there is certainly work that the exchange can do to vet these insurance carriers, but establishing the objective criteria by which we're going to vet, their services is, I think, also a process that the board should be included in. So just to kind of summarize, Dr. Jamison, it sounds like there's an appetite for the exchange to present either at the October board meeting or perhaps before then, a plan for perhaps a draft of a policy that would apply to endorsements for non-health and dental carriers. I would say, it could be vision carriers in particular, but by saying non-health and non-dental carriers, maybe we wouldn't strain ourselves quite as much, be a little more flexible. Does that sound like an agreeable proposal?
Yes, and I think what you mentioned about having some accountability in there is excellent. As all of us reviewed for the day's meeting, the semi-annual fiscal and operational report, and one of the things we look at and focus on is those calls and how they're managed and responded to. I think that it's kind of like when you drive through a lot of establishments, and if you have any problems, be sure to call this number, that when we post these on the website, there should be something similar in a pathway. You said it. I think a good plan, and we can move on.
Okay, wonderful. I do see
Like-
a hand raised from Radhika Kular-Dag. Please go ahead, Radhika.
Hey, in the interest of staying on top of topic and staying within the noticed agenda, I just wanted to send a friendly nudge to keep the conversations and topics to what's been agendized. I know the ED report is on the agenda, but the notice is only provided to the headline. So as long as we stay within the purview of what's noticed, we align ourselves with the OML. I'm not indicating that any of the previous topics were out of scope, but I felt like there were certain areas that were beyond the scope of what's been noticed.
Well, I always
So
appreciate
just a
the
friendly
reminder.
reminder.
Thank you very
Thank
much. I
you.
look forward to updating the board on our plans in the interim prior to the October meeting.
Thank you.
All right. The next section is the 4-month look ahead. Historically, the bulk of the updates that Exchange staff have presented to the board have been retrospective in nature. As part of my goal to better include the board in the day-to-day operations of the Exchange, though, I'm establishing a look ahead section of the Executive Director's report to highlight significant activities occurring in the interim between today's meeting and the October board meeting. From my perspective, as someone who's worked for the Exchange since 2016, I don't recall a busier or more critical 4-month period. The first milestone is RFPs. The Exchange is planning on releasing 2 RFPs or requests for proposals during the upcoming interim. The first relates to a CMS requirement for state exchanges to engage the services of a third-party information security consultant to perform an independent security assessment, or ISA. Conducting an ISA is a tri-annual requirement, and this will be the Exchange's 3rd ISA since moving away from the healthcare.gov platform. We hope to release this RFP in early August with at least a 6-week response window. The contract period for ISA services will run from January 2025 through July of 2025. The second RFP will be a 2-part solicitation for technology platform and call center services due to our existing contract with Good & Short expiring at the end of plan year 2025. This RFP will be patterned after the original RFP issued in 2018 and will allow vendors to provide a response for technology platform services alone, call center services alone, or both services in a single proposal. We hope to release this RFP in late August with at least a 2-month response window. In the event of a vendor change for either the call center or the technology platform, a significant amount of time and resources will be required to navigate the transition, which is why the Exchange is building a substantial runway into the project timeline. The next milestone is plan certification. The Exchange's annual plan certification process is underway and will continue through the end of September. This process, which is conducted in collaboration with the Division of Insurance, ensures that all qualified health and dental plans sold through the Nevada HealthLink marketplace meet the minimum requirements of ACA regulations. These requirements include minimum standards for benefit design, prescription drug coverage, actuarial value, and provider network adequacy. At present, the Exchange's plan certification responsibilities are handled by a single plan certification manager. The next milestone is our biennial budget. The Exchange's finance team has already begun preparing our biennial budget in preparation for the 2025 legislative session. This budget, which includes all operational, personnel, and vendor expenses for fiscal years 2026 and 2027, must be submitted at the end of August. We are planning on requesting 2 new positions in the upcoming budget. One will be a support position for our plan certification manager in order to accommodate the anticipated increase in the number of insurance carriers selling plans on the Exchange following implementation of Nevada's Market Stabilization Program. The other will be a dedicated full-time position for a tribal liaison in order to deepen our commitment to Nevada's 28 federally recognized tribes and ensure the enduring success of the Exchange's Tribal Partnership Program. The Exchange welcomes any comments or feedback from the board regarding these proposed positions.
I would
And
like to
we'll pause at the
congratulate
end.
you again on the work you've done with the tribes. I just was at the AMA conference, and many of the other states that have exchanges and have also tribes that may not have the best access to healthcare are very curious about this process. So you may hear from some of them.
We have been very honored to receive inquiries from a number of state-based marketplaces thus far, and the meetings have been very productive. We've learned a lot about approaches they consider, just as we've been able to share some information. So I appreciate the comment.
Thank you. Thank you.
I'm realizing now I could have worded the last sentence of the last section a little bit better in terms of feedback from the board. I will, of course, pause at the end of this section, the format look ahead for any comments or questions. So didn't mean to confuse the issue there, but appreciate the recognition, Dr. Jacobson. Thank you. The next milestone is annual policy updates. This year's Okay, yeah, I just want to make sure I didn't skip a section. My apologies. This year's annual notice of benefit and payment parameters, or NBPP, from CMS included several dozen rule changes that will require corresponding updates to the exchange's policy manual. Many of these changes will also require changes to the design and behavior of the Nevada HealthLink website platform. These changes are currently being coordinated by the exchange's policy team with the goal of circulating a draft release of the policy manual to stakeholders in August, followed by the release of the final version in September. Details regarding the rule changes have been omitted here for brevity, but if desired, the exchange can provide a follow-up email to board members with additional information. The next milestone relates to our fall marketing campaign. The exchange's communications team and marketing vendor, the Abbey Agency, will be working throughout the summer to develop our fall marketing campaign. Details of the campaign itself are provided in the Abbey Agency's marketing and outreach presentation, so I won't repeat them here, but I did want to highlight the significance of the recent focus groups they conducted. My biggest takeaway from the feedback gathered was that the exchange should consider simplifying its approach to brand awareness, with a focus on defining exactly what the Nevada HealthLink Marketplace is and how the marketplace is different from other outlets for purchasing insurance coverage. The next milestone relates to federal privacy and security.
I just have a question on this.
Yes.
Since they have been doing an outstanding job, and you're right, I like them focusing on simpler. I agree, it's all beautiful. I just wondered, we just talked about a couple RFPs, and I remember when we had an RFP for our marketing companies, and I just wondered how long our contract with them right now is. When does that end? Will there be an RFP out soon, or are we good with them for a while?
Forgive me, Dr. Jameson. I know I believe we're within the final year of our contract. If it's okay with the board and if it's okay with Radhika, I wanted to ask if there's anyone else on the line here, either Janelle Davis, our operations manager, or perhaps Caitlin Blagan, who's filling in for Katie Charleston, our communications manager, who can confirm the answer to that question regarding the expiration of the Abbey Agency's existing contract.
I was just curious because they've been doing such an outstanding job. If it was going to come up next meeting, but that's okay though. We can move on. It's fine.
I would be more than happy, if it's okay with you, Radhika, to provide an email update after the fact, and I'll make a note right now to do so. Does that sound okay, Radhika?
Yeah, and also that is an agendized item at a later time, right? Maybe that's a question for the agenda item.
Yes.
405, yeah.
That's an excellent point.
Unless the chair decides to deviate from go out of the order and calls in an item out of the order. Okay, thank you.
Wonderful. Thank you again, Radhika, for the assistance. Okay, so I will move on then to the next milestone, which is federal privacy and security compliance. Each year, the exchange is required to update and submit to CMS a substantial body of documentation demonstrating our compliance with federal privacy and security requirements. We are also required to update and submit to the IRS a comprehensive document known as the Safeguard Security Report in order to maintain authorization to use the IRS's Income and Family Size Verification, or IFSV service, a mandatory component of the exchange's process for verifying subsidy eligibility. Max Borgman, the exchange's information systems manager, will be working closely with the Get Insured Information Security team in the coming months to ensure that all required documentation is updated and submitted by the applicable deadlines which is July 31st for the IRS Safeguard Security Report and August 16th for the CMS documents. The next milestone relates to an ongoing LCB audit. Throughout the summer and fall of 2023, the exchange hosted a number of site visits for Nevada's Legislative Council Bureau, or LCB, who were conducting an on-site audit of the exchange's operational privacy and security controls. On June 24th, the exchange team will be meeting with the LCB team to accept delivery of their findings, which we anticipate to be relatively few in number and low in severity. The exchange will then develop a corrective action plan to address and resolve any remaining deficiencies. I want to take the opportunity to commend Max Borgen for his diligent work over the past 9 months to preemptively resolve a number of LCB's preliminary findings, which will streamline the process of implementing the exchange's remaining corrective action. On balance, the audit was a confidence-building exercise, and we appreciate the opportunity to have collaborated with LCB's subject matter experts. The next milestone is an IRS audit. The exchange recently received notification from the IRS that they will be conducting an on-site privacy and security audit during the second week of September. This will be the first such audit for the exchange, and based on feedback from other states who completed similar audits, we are anticipating a heavy lift. But we are also feeling well prepared, thanks in large part to the recent operational improvements, which were prompted by the LCB audit. The next milestone relates to automatic voter registration. The exchange was named as an automatic voter registration agency in AB 432 during the 2021 legislative session, which requires the submission of marketplace applicant data to the Nevada Secretary of State's office to facilitate the automated voter registration of qualified individuals. AB 432 originally mandated an implementation date of January 1st, 2024, but AB 192 from the 2023 legislative session extended the implementation deadline to January 1st of 2025. The exchange has met with the Secretary of State's office in recent months to confirm the technical requirements for implementation. At present, we believe that the exchange will be able to meet those requirements with existing staff resources and expertise without a reliance on support from our technology vendor. We also believe that such an approach is in the best interest of the state. Our goal is to have a solution prototyped in time for a more detailed presentation during the October board meeting. The last milestone of the 4-month outlook involves our annual passive renewals job. Work on the annual passive renewals job begins in July with a complete staged run that allows the exchange and technology vendor Get Insured to identify eligibility or data quality issues which could potentially be resolved prior to the October production run. The continued refinement of this process allowed the exchange to achieve a renewal success rate of greater than 99% last fall, and we anticipate a similar result from this year's job. A new challenge that we will face this year involves CMS's introduction of a per transaction fee associated with Equifax's Verified Current Income, or VCI service, which has been an integral part of the exchange's eligibility verification workflow in the past. More details are provided in the executive summary section of the fiscal and operational report, but the new expense posed by this change has resulted in a desire by the exchange to find innovative solutions for reducing the overall use of the VCI service. I will now pause for any questions or comments from the board.
Do our board members, ex officio members or others have any questions regarding this at this point? So I did see in the report, as you say, more information on this subject. So although I will not be the chair at that time, I will be looking to see very curiously what the cost per client is going to run. And so I didn't get any hint of it in the follow-up in the operational report.
Since you asked, I'm happy to share, Madam Chair. The per transaction or per household fee is approximately $5 for the next year, beginning on July 1st. And then it will ramp up gradually through federal fiscal year 2027 to over $9 per household. So it is a non-trivial expense. And this a similar scenario is facing state Medicaid agencies as well. So this is definitely a big operational change. I did want to share, and this repeats a little bit of information in the fiscal and operational report. But we had a very short timeline to prepare for this change, only a couple of months really. And the amount of operational changes as well as the staffing changes that would be required in our call center, and I explain a little bit more about why that would be in the fiscal and operational report, would require more time than we had. So we made a calculated decision to continue utilizing the service from July 1st of this year through June 30th of next year. And we're going to be keeping very close tabs on the essentially the benefit that this investment is providing to us. The chief benefit that this service provides to our consumers is that if and when the IRS IFSB service is unable to verify income for a given household, if we're able to verify it by using the VCI as a fallback service, then we prevent that household from being required to upload supporting documentation. Now, that's a mild bit of consumer abrasion, and we do see some attrition each year from households who, for whatever reason, either fail to or are unable to provide the required supporting documentation. They lose their subsidy eligibility. They might then become subject to termination for non-payment due to a past due balance. We're going to be keeping very close tabs on that. Essentially, what we want to define is how much money are we spending for each household that is being spared the inconvenience of uploading that supporting documentation. We will then present that information to the board. We should have a pretty good answer of what that number is by the February board meeting, having just completed the open enrollment period. So that's in a nutshell, that's our plan for next year.
And that is on our next board agenda. So thank you so much.
Absolutely, my pleasure. So with the board's permission, this is Russell Cook again for the record. I will move on to the next section of the executive director's update, which is an update on workshop approach to public comment solicitation. The exchange recently conducted 2 public comment workshops to gather stakeholder feedback on our language access plan, or LAP. As will be mentioned in the introduction to the LAP agenda item, both workshops were characterized by a lack of critical feedback. But the organization of the workshops themselves provided the exchange with a valuable opportunity to assess the effectiveness of this format for the solicitation of public comments, and in that regard, the workshops presented a great success. Both meetings proceeded smoothly and efficiently, and I'm especially grateful for the significant amount of time that Radhika Kunal, the exchange's Deputy Attorney General, devoted to preparing our staff and ensuring that both workshops were conducted in strict accordance with open meeting laws. I believe that the exchange now possesses a valuable new tool for improving stakeholder communications. I will now pause for any questions or comments from the board.
Yes, congratulations on a successful format. Maybe next time more than 1 to 2 comments will be made per meeting.
Well, as I mentioned in the introduction of the language access plan, that was an encouraging sign. It was not perhaps the robust dialogue that we were prepared for, but was a vote of confidence for the comprehensiveness of our approach to serving our limited English proficiency population. So all in all, I guess a win-win.
A success.
All right, Russell Cook for the record. I will now move on to the market stabilization program. The implementation of Nevada's Market Stabilization Program, formerly known as the Public Option, continues to proceed under the capable leadership of the administrative team at the Division of Healthcare Financing and Policy, or DHCFP. In February, I notified the board of a lawsuit that was filed by Senator Robin Titus and a nonprofit group called the National Taxpayers Union, seeking declaratory and injunctive relief against the implementation of the Market Stabilization Program. A few days later, I received notification that the Attorney General's Office and the Legislative Counsel Bureau had each filed motions to dismiss the lawsuit on February 23rd, citing concerns about its procedural and jurisdictional basis. On May 21st, I received another update indicating that the court has set a hearing on the motions to dismiss for June 26th, after which I will be updated on the results of the hearing. We will, of course, forward this update to the board once it has been received. In recent weeks, the exchange has been working with the DHCFP team to develop marketing and implementation strategies for the product. One particular area of interest relates to the possibility of passively renewing Nevada Helping enrollees from their existing plans into the forthcoming battle-born state plans in October of next year. Existing federal regulations require state-based marketplaces to passively renew consumers into their existing plan if it is still available. However, other states who've implemented public option programs have convinced CMS to waive this requirement in the financial interest of impacted consumers. Nevada is currently pursuing a similar strategy with its waiver request. The next major project milestone will be the Managed Care Organization, or MCO RFP, which is anticipated to be released in September of this year. MCO awardees will be required to offer battle-born state plans for sale through the Nevada Health Inc. Marketplace, and the exchange anticipates that this process will result in several new insurance carriers entering the marketplace for plan year 2026. The timing of the RFP should allow the list of awardees to be finalized by approximately March of 2025, which should provide ample time for the exchange to onboard these new carriers and complete the required testing for electronic data interchange and enrollment reconciliation functions. I will now pause for questions or comments from the board.
Does our board have any comments? I would say that this has an excellent example. I appreciate that our motive, our very existence, our mission and vision is about helping our Nevadans have access to affordable, quality healthcare. And so making it more affordable to those people in the low economic tier is even more important. And by having this automatic, getting a waiver to have this happen automatically is very good. But this is exactly one of those kinds of things that would have been nice to bring back to the board.
I'm sorry, for decision-making,
Yeah.
inclusion, that sort of thing?
Yeah.
Okay. I appreciate the comment, and I will definitely take that under advisement.
Yeah, so that was very good, though. Yeah.
Okay. Well, we will look for opportunities in the future to involve the board. We still got a pretty good runway ahead of us, and I really do appreciate the feedback, Dr. Jameson.
Yeah, but you've done a beautiful job on this.
Well, I want to emphasize that our agency has been playing a support role, and that Stacy Weeks and her team have done, in my opinion, beyond an admirable job getting us to this juncture. The complexity of this project truly boggles the mind, and I continue to be impressed by the handling. So thank you very much, Ms. Weeks.
Jonathan Johnson here. So my question is, are there other states that have had the public option and not been like the default or passive enroll option? This is the first question. The second one, kind of closely related in my mind, is enrolling members in the public option. Is that at a lower cost to that participant because they're already, getting a subsidy that's income based? They're paying based on their income, not the cost of the plan. So if it's not a cost factor, why are we going to say, hey, you've always purchased Diet Coke, now we're gonna enroll you and just give you Diet Pepsi?
So I think I'd like to answer that in reverse order. Premium reduction targets, and yes, I see a hand from Ms. Weeks.
Can I just jump in, Russell? I'm a little frustrated that you and I did not discuss these comments because a lot of this is confidential negotiations with CMS. So first of all, I would just note that the passive enrollment, my understanding, is not tied to public options. States are doing this in the federal exchanges. It has nothing to do with the public option. CMS just wants to see us work as a state to put people in a more affordable option. It does not have to be the public option. So I think there might be some confusion of tying this to the public option. This is an opportunity for the exchange to do something that the federal exchanges can do, and there are tools to help people find a more affordable plan. It may not be the public option. So Russell, if you think it is, then we need to have that conversation, because that's not the approach that we were trying to take. We were trying to respond to CMS, wanting to push our exchange to do the enrollment where people are not just automatically put back in a plan without them knowing that there could be a more affordable option. Whether or not it's a public option or not has nothing to do with that. So I just want to clarify for that conversation.
Thank you, Stacy, for clarifying. And I think what we'll do, since there are sensitive topics here, we won't as our DAG would recommend, go off on a tangent on this at this point, but we really appreciate that update on this because it is a complicated issue. And we can have you guys work on this, vet it out further, and bring it back to the next board meeting. Stacy, thank you.
Thank you, Madam Chair.
Russell Cook for the record. The next section of the Executive Director's report covers Medicaid unwinding. The exchange continues to receive several thousand electronic referrals each month of Medicaid or CHIP enrollees whose coverage was terminated as part of the unwinding of the public health emergency. As of June 1st, 2024, the exchange has received referrals for a total of approximately 114,700 unique individuals throughout the unwinding period, of which approximately 6,500 have enrolled in marketplace coverage. This represents a cumulative conversion rate of 5.6%. In an effort to improve this conversion rate, the exchange recently implemented a direct-to-consumer SMS messaging campaign. This campaign aims to inform consumers of their available options for enrollment through Nevada HealthLink, and the messaging differs depending on how recently a given household was redetermined as Medicaid or CHIP ineligible. Those who lost eligibility within the previous 60 days are encouraged to act now to avoid a gap in coverage. Those who lost eligibility more than 60 days prior are notified that they are still eligible to enroll in marketplace coverage through November 30th, per CMS's recent extension of the unwinding related special enrollment period. The exchange does not yet have enough data with which to gauge the success of the campaign, but we look forward to providing a detailed update at the October board meeting. I will now pause for questions and comments from the board.
I hear no questions or comments. Are there any hands up?
All right, hearing no questions and seeing no hands, I will move on to the next section, Tribal Sponsorship and Tribal Partnership Program. In recent months, our ongoing work in support of Nevada's tribes has consisted primarily of seeking support from the exchange's insurance carriers for our monthly aggregated billing workflow. This process aggregates the monthly premiums of individual enrollments which qualify for premium sponsorship by their respective tribe, allowing for a single monthly payment covering all sponsored enrollments. Thus far, 4 of the exchange's 8 health carriers have expressed support, and we hope to bring the remaining carriers on board in the coming weeks. Another area of progress relates to difficulties that tribes have experienced with specialist referral claims, which is a consistent area of frustration that tribes have reported to the exchange. Over the past few months, we've learned a great deal from our carriers about tools that tribal health centers can use to send electronic notifications of specialist referrals to their respective insurance carriers. These tools have the potential to greatly improve the accuracy of referral claims processing with respect to cost-sharing reduction benefits for AIAN enrollees. We are anxious to share this information with our tribal stakeholders as we work to deepen the exchange's support for these communities. Lastly, I would like to update the board on a recent change that was made to the branding of the exchange's Tribal Support Initiative. In prior updates, we have referred to this initiative as the Tribal Sponsorship Program, but the exchange recently became aware of some confusion that this moniker was causing amongst our tribal stakeholders. Guidance published by the Indian Health Services uses the phrase tribal sponsorship in specific reference to the sponsorship of monthly premiums, i.e. the third-party pay arrangement in which tribes pay the monthly insurance premiums of qualifying members. Since aggregation of monthly premiums is only one component of our support services, the exchange has rebranded our initiative as the Tribal Partnership Program, which we believe is more representative of our broad commitment to serving Nevada's tribal nations. I will now pause again for comments or questions from the board. Commissioner Kipper, yes.
Yeah, again, and I know we've had this conversation between DOI staff and exchange staff, but if there's a question or concern about the specialist and referrals, simply request that you use the division as a resource. I mean, we have the regulatory authority to work with the carriers to ensure that those tribal members do get a proper specialist as referred as per the contract that they're insured under. So we just, again, reach out and make that request. And we look forward to greater collaboration with the exchange and the tribal representatives.
Thank you, Commissioner. I appreciate the suggestion. Russell Cook, for the record, I just wanted to share a little bit more insight into the specific difficulties that have been encountered. The referral claims themselves are working properly. The specialist services are being provided. The trouble they've been encountering comes when the specialist claims get submitted to the respective insurance carrier. They don't always have the appropriate cost sharing reduction benefits applied to them. In conversations with insurance carriers, we have learned that this is largely a technical problem because in most cases, these systems do not have an electronic record of that referral being submitted to them from the authorized primary care physician. So the specific nature of the support that we're trying to provide is to inform and educate tribal health centers, tribal benefits managers in particular, on methods that might be available to them through electronic web portals to submit notification of these referrals, much like a prior authorization function. But absolutely, we appreciate the offer for collaboration, and we will certainly keep you apprised on our progress. And if we do run across any novel or unanticipated problems, certainly our first course of action is always to refer those over to the division.
And certainly it's part of that, the referral process, but also if there's a claims adjudication issue, we would also make that same offer.
We appreciate that, Commissioner. We will definitely keep you in the loop. Thank you. All right, if there are no further questions, I'm going to move on to the final section of the Executive Director report, which is personnel updates. And I would be remiss if I didn't begin this section by acknowledging that today marks the final board meeting of our current chair, Dr. Florence Jameson. Dr. Jameson has been an integral part of the Exchange's spirit and drive since before I began working here in 2016, and I feel honored to express on behalf of the Exchange's staff, both past and present, our gratitude for her steady temperament, warm demeanor, and compassionate leadership. By any objective measure, the accomplishments of the Exchange under her watch represent an astonishing body of work. And on a personal level, I'm extremely grateful for all that she has done to help me grow into the very big shoes of the Executive Director position over the last year. Thank you, Dr. Jameson, for your vigilant guidance. We wish you the very best of luck in your future endeavors.
Thank you, Russell.
I'm happy to report that as of April 1st, the Exchange is operating at full staff with 0 vacancies for the first time since the pre-pandemic era. It's my belief that our current staff represents as dedicated and capable a group of employees as the Exchange has ever known. As you know, filling all remaining vacancies has been one of my top priorities since assuming the director's position. Doing so has been a tall order, and I want to take the opportunity to thank the Exchange's supervisors for their diligent efforts in conducting no fewer than 10 successful recruitments in as many months. I regret to inform the board, however, that the Exchange will not be at full staff for much longer. A bit of background information would be required to properly explain the circumstances, but I believe it's important for the board to have some insight into these proceedings. In the fall of 2021, the Division of Human Resource Management, or DHRM, approved one of our senior staff members to move out of the state and continue his service to the state by working remotely. Throughout 2023, the Exchange awaited the release of the governor's statewide remote work policy with great interest, as we were concerned that changing regulations might jeopardize this individual's continued employment. The only relevant guidance available at the time was a document hosted on DHRM's website, which enumerated 7 reasons for agency directors to consider approving out-of-state telework. These reasons included recruiting or retaining a rare skill set, which incidentally was the justification for approving this employee's move in the first place, and legacy agreements for previously approved out-of-state work when it is working well and continuing to meet business needs. When the statewide remote work policy was released in December of last year, it granted latitude to agency directors to approve remote work as a limited discretionary privilege. No mention was made of out-of-state telework, save for 2 stipulations of the policy, which were identified as not applying to workers who are permanently stationed outside of the state. The policy appeared to be entirely compatible with the guidance on DHRM's website, with no apparent contradictions between the 2 documents. We therefore breathed a collective sigh of relief, and in January, I approved a remote work agreement as required by the statewide policy to allow our out-of-state employee to continue working remotely. In late February, I received a request from the governor's office to provide our agencies remote work agreements for their review. Shortly after providing our agreements, I was notified that the exchange was not an agency which had been approved for out-of-state or outstation employees. I requested clarification as I was concerned that the exchange might have been operating out of compliance with existing regulations, but no clarification was provided. A few weeks later, the governor's office advised agency directors that they were no longer authorized to employ personnel who were working remotely from out of state, and that we were either to bring them back into the state or let them go. No guidance was provided regarding a method for dismissal. The aforementioned document on the DHRM website was eventually removed, and the Attorney General's or AG's office later confirmed that the document is not an official sanctioned policy of the state and that it is inappropriate to base any remote work policy or decisions on the document. This scenario presented a human resources challenge for which the exchange had no precedent. Permanent classified employees of the state of Nevada enjoy substantial protections to their employment status under the Nevada Administrative Code. Before they can be dismissed, they must be notified of an alleged violation of conduct, after which an investigation is conducted to validate the allegation. If the allegation is confirmed, then the level of discipline is determined, and a lawful basis for the recommended disciplinary action must be approved by the Attorney General's office. For this reason, I was immediately concerned with identifying a lawful basis for dismissing the employee in question. Over the last 3 months, our agency has sought guidance on this topic from the governor's office, DHRM, and the AG's office. Initially, I thought that if a prohibition against out-of-state telework or even out-of-state residency itself could be identified, then a lawful basis for termination would exist. But there is apparently no such regulatory prohibition. The eventual guidance from the AG's office, which we received on June 6, was that I was to order this employee to report for work at the exchange's Carson City offices. After failing to report for on-site work on the prescribed date, he would eventually be dismissed for insubordination, having failed to comply with the order, and possibly also for being absent without leave or AWOL. I want to emphasize that I have, at every juncture, endeavored to ensure that the state remained protected from any potential liability for wrongful dismissal. The exchange unequivocally supports the priorities of the governor's office, and my deliberation throughout this process has stemmed from caution, not from opposition. On June 10th, I notified the employee in question to report for work at his Carson City office location by July 1st. But I deeply regret that the state's only suggested course of action requires the exchange to tarnish the otherwise impeccable personnel record of a model employee. Throughout this entire process, he has maintained his substantial workload while conducting himself with the utmost professionalism and integrity, knowing full well that his employment status was in jeopardy, but not knowing when or how his dismissal would occur. I believe his commitment to this agency is worthy of the utmost respect and commendation. That concludes my executive director's report, and I will now take any questions or comments from the board.
Are there any questions or comments from the board?
Ms. Clark, yes.
Sorry. Thank you, Madam Chair. And Russell, I just want to understand that it's not necessarily that he has to be terminated. You have a return to work policy. He could choose to just resign because he can't comply, correct?
Voluntary resignation is an option. Doing so would entail waiving a number of rights that are available to classified employees. So it's definitely not a comparable equivalent to a lawful dismissal.
Okay, so we're not. He doesn't have to part ways in a negative way. I understand he doesn't want to give up any rights, but it doesn't have to be, it's not a requirement that it looks negative on him if he were to depart. Correct?
My understanding.
Excuse me, I'm sorry. I will have to interrupt right there because some of these conversations and topics are going not only beyond the scope, but also protected under certain other aspects of OML 241 and things of that nature. It relates to personnel issues. And one other thing I have to say in that particular brief that Russell has divulged some of those points would be considered as protected under attorney-client privilege. And well, it is for the client to waive that right, but I just wanted to put this on the record. And thank you.
Okay, thank you.
Thank you. Thank you so much. And the only comment I think it would be okay to say is I just would like to give my gratitude for trying to protect everybody's interest in this changes and respecting the governor's policy. And thank you so much. Okay, I think we're ready to move on. And yeah, that was an outstanding report. Russell, thank you so much. I think the board really sees where we have been and where we're going. I love your new approach going forward to give us a little idea of what's about to roll out. That was really well done. Thank you. We are now going to go to the marketing outreach update presented by the Exchange and marketing partner Abby Agency. And here we're going to see what Russell has given us a little glimpse of, that they want to go to a more simple approach in soliciting our clients. Please proceed.
Good afternoon, everyone. Connie Anderson for the record. Caitlin, will you be reading the written report first before I go into the presentation? Or Janelle?
Hi, Connie, Janelle, the reading.
Okay, thank you.
I will be reading the report. I wasn't sure if we were just going to skip over that section. So yes, I have that for us. This is just a summary, and I'm sorry, really quick, Janelle Davis. I'm the Chief Operations Officer at the Exchange. And I will be just giving some general comments on the marketing and outreach report since our communications officer is on maternity leave. And so I have very much summarized the lengthy presentation and what's in the fiscal and operational report. So this will be fairly quick, and then we'll let the Abby Agency present with some visual aids. All right, so the period after OEP, open enrollment, from January to June of 2024 has been a time for the Exchange, the Abby Agency, Marketing for Change, which is a subcontractor to the Abby Agency, and our research team to dive deeper into Nevada HealthLink's audience and better understand the customer journey and the customer's level of understanding. Also their needs and wants when it comes to health insurance coverage. Marketing for Change conducted several research studies. Russell alluded to this in his report after the conclusion of the open enrollment period, and this was to build a more detailed understanding of the Nevada consumer. The Exchange's communications team and the Abby Agency have worked together to message the special enrollment period to target audiences that have experienced qualifying life events. This campaign featured website landing pages in both English and Spanish, a revised creative concept with simplified messaging, digitally focused advertising, and a robust community outreach program. The Abby Agency and the Exchange also worked closely on the continuation of the public health emergency campaign. As the redetermination process has been extended, the Abby Agency has identified opportunities to enhance ad performance, assisted with development of the text messaging campaign, and connected the Exchange with both regional and national news outlets to discuss the coverage options available for former Medicaid recipients on NevadaHealthLink.com. Lastly, the Abby Agency and Erica Avila's Consulting, a subcontractor of the Abby Agency specializing in Hispanic media and outreach, developed a comprehensive off-season content plan centered on the Hispanic and Latino communities. This plan is strategically designed to follow relevant healthcare topics and themes, ensuring that the content is both community-focused and engaging. By aligning the efforts of community outreach, public relations, and digital content teams, the plan ensures that Nevada HealthLink effectively highlights key messages across all communication channels. Furthermore, Erica Avila's Consulting proposed several innovative ideas for the off-season aimed at engaging multicultural communities and delivering key messages to broader audiences through collaboration with community partners. EAC also enhanced Nevada HealthLink's off-season presence by increasing community engagement, They developed more Hispanic-focused social media posts showcasing Nevada HealthLink navigators actively working within the Hispanic community. They also implemented a collaborative social media series called On the Road with Rosa, with Nevada HealthLink's brand ambassador Rosa Alejandre and RTC Southern Nevada, which connected the local community to navigators, further boosting brand awareness. These initiatives are part of the strategic plan to ensure that Nevada HealthLink remains visible and engaged with the community throughout the off-season period. In support of marketing efforts, multiple research studies were conducted. Marketing for Change designed and fielded 3 surveys immediately following the end of OEP in January. So those 3 are a robust survey of Nevada residents, including a subsample of Spanish-speaking Nevadans, a survey of current Nevada HealthLink consumers, and a survey of enrollees that terminated their plan with Nevada HealthLink. A quick update on the unwinding and redeterminations. The exchange and the Abbey agency continue to execute a target marketing and outreach strategy to inform Nevadans about the ongoing redeterminations of Medicaid eligibility and drive the affected individuals to seek coverage through Nevada HealthLink. Excuse me, given the significant challenges in driving enrollments from this audience, the exchange made the decision to move forward with adding an SMS texting campaign to supplement our marketing and outreach efforts to reach those individuals whose information was shared with the exchange through the account transfer process. The Abbey agency drafted and distributed a press release highlighting the new texting campaign as another opportunity to garner earned media attention and reach potential enrollees from this audience. A little bit on the special enrollment period and our campaign overview. The overarching goal was to have a targeted campaign that spoke directly to the identified targeted audiences who recently experienced a qualifying life event. The campaign creative is heavy on clear and distinct messaging and uses bold colors from the branded color palette to draw attention. After identifying the qualifying life events most frequently selected by consumers, target audiences for this campaign were outlined as follows. Those who recently experienced a change in household size, birth or adoption, income or employment status, a loss of health coverage, or have moved to Nevada or a new service area within the state. A little bit on public relations. After OEP wrapped up in mid-January, we were focused on pushing post-open enrollment messaging, highlighting the strong number of enrollees. With nearly 100,000 consumers enrolled in health insurance by the end of open enrollment, the Abbey agency and the exchange pushed out a statewide press release and individual media pitches around why this enrollment was so successful and the impact it has had on Nevadans. This was also completed by an op-ed in the Nevada Independent that the Abbey agency helped draft and place on behalf of Russell Cook, emphasizing the need for expanded access to affordable healthcare coverage. In March, we sent out a press release on behalf of the exchange highlighting the 14th anniversary of the Affordable Care Act. This garnered statewide coverage and reminded Nevadans of how the ACA has helped more Nevadans become enrolled in insurance and why it still matters today. And a little bit on community relations and event outreach. So during the off-season period, community relations and event outreach teams were focused on enriching the off-season marketing plan through community outreach, attendance of events, and key sponsorships. Navigators are projected to participate in 94 community events between January and June. More than 47,000 people attended the events where we had navigators attending, and they reported over 10,000 interactions with attendees. Nevada HealthLink also completed a total of 44 sponsorships. And Erica Aviles Consulting researched and provided the Hispanic Latino collaborations with organizations serving underserved communities by facilitating and securing tabling events, presentation opportunities, and sponsorships targeting these communities. All right, and that is the summary of the Marketing and Outreach Report, and I'll turn it back over to Connie Anderson.
Thank you. Was there any questions before Connie goes ahead and gives us our visual? And a lot of this will be reinforced with this beautiful visual. Go for it.
Absolutely. Thank you, Janelle. Our team is always very proud and honored to work with Nevada HealthLink and the outreach that they do. It's been a busy open enrollment. I know we went through that in our last board report, and it's been a busy special enrollment period so far. So today we're going to take a look back at the first 6 months or so of the year. We provide this report in early June. So the data that you're seeing and that Janelle reported goes through early May. I also have two of our wonderful colleagues on the phone, Peter from Marketing for Change and Owen from my team, and they will be helping to present a few of the slides today. So overall, looking at our strategy, when we're looking at the off season, that time outside of OEP, we are looking at making sure that Nevadans still know that they have access to health insurance coverage, whether that's because they perhaps have a qualifying life event, or if that's because they have fallen off of Medicaid or are becoming unwound from Medicaid. As Russell indicated, our team has looked at really simplifying our messages overall to make sure that Nevadans know that NevadaHealthLink.com is the official marketplace, and that this is the only place that you can find subsidies. I'm going to turn it over to Peter now, who's going to talk a little bit more in depth about two of the research projects that we've completed recently.
Well, so just as the Abbey people are very busy during OEP, we get very busy at the end of OEP, looking at evaluation and running a very large quant study. We actually surveyed more than 4,000 people after to do this. That includes 26 over 2,600 general population to get their feeling about the process and look at our market. We did about 976 users, evaluated them. We also had 373 from Spanish speaking population. That was a new thing we added this year, is to look at the Spanish speaking population. In addition to that, this year we added looking at the leavers. These were people that had left, had been passively enrolled and then left, mostly because they had found coverage elsewhere, but some because of cost. And so we do that because we want to know what does the market look like, what do our customers think, and how well did OEP go? And the basic answer to that is the market is fairly similar to what we found last year. This is the second year we've done this. And this study is actually, I believe, the most extensive quant survey looking at who's insured, who's uninsured, outside of the one the census does through the American Community Survey. So that one is dated, obviously, because it comes out about a year later and it's done month by month when they do the ACS. What we, in general, what we learned is our market is basically 19% of Nevadans, that's 1 in 5, are either uninsured, independently insured, or insured through Nevada HealthLink. One of the kind of insights from this is that lots of these people are eligible for subsidy. When we do a back of the envelope, knowing their number of people in their household and their income, about half of this population is eligible for subsidies. That's about 56% of the uninsured, 44% of the independently insured. So we focused on these in the qualitative, and we'll get in that in just a second. But we also saw that the favorability went up very slightly of Nevada HealthLink, but pretty much similar to what we've seen earlier, where we have about 1 in 5 that have never heard of Nevada HealthLink, and 41% with no opinion, and then we went from up to 22%. I'm sorry, up to 26% favorable. From the users, we found out that we actually went up there. The Net Promoter Score, which is a measure of would you recommend this to somebody else, went up from 24 to 33 this year. And we found similar issues. The issues that people did have, the people that were the minority of people that had any sort of negative opinion, it was about cost, it was about the policies, about the particular carrier complaints, and then difficulty shopping for plans and website issues. I think that, and then I want to go to the next slide with a qualitative, and talk a little bit about, this was where we looked at the subsidy eligible population that we really want to focus on. Oh, go ahead.
I just wanted to ask a question because you did such a great job of interviewing and questioning so many people. I might have missed it, but I just think that including a real breakdown of those that, as you say, the leavers or those that terminated their plan, I know for one, and perhaps the other board members would be very curious in future similar studies, and you probably have the data to include it because some of them may have become, I would love to know, is this 100 of them that terminated? Is it 1,000 that terminated? I would love to know if it was because they had got a job, an employee-based insurance, whether it was they got on Medicaid, whether they left town, left the state. And so I just think that's a nice.
So we have a full report on that we can provide you certainly, and has all the data. But just quickly, since you asked the question, and I love giving out data, about 2/3 of them had found insurance elsewhere, mostly group insurance, Medicaid, or Medicare. So they had found elsewhere insured. There were, as far as the reasons that were the most common reason outside of that. So 2/3 of them. Now we're just looking at 1/3. A little less than half of that, 14%, left because of cost. They thought the cost was just too high. And then those were the top
mind share of them.
Yeah.
Thank you so much.
But we can give you the full breakdown. We have lots of reports.
That was just nice to know.
We can put you to sleep forever. You can read these before bed if you're having trouble.
No, that was a good big picture. Thank you.
Okay. I see that she's talking, but I think your mic is on.
Stacy, we can't hear you. Sorry, I still cannot hear you. Sorry, Stacy.
Does that work better? I'm still
Yes.
dealing with Zoom today. I don't know. It doesn't like me. Peter, I just have a quick question on the cost. I'm assuming that's premium cost, or were you guys specific about
Absolutely.
not deductible? Okay.
Although, we found in other research that we do a lot of research at this around the country, that people are more and more paying attention to the things like deductibles. So and I believe the question was worded, the overall cost. So we don't, it typically is premiums. I know from qualitative responses and open ends, but that's, deductibles are definitely things people want for, and so.
Good point.
Okay, thank you.
One of the things that we looked at subsidy eligible, because there's a large share of them we know from the quant. I think it's about, where did I have this? I have this here. About 44% of the people that decide not to follow up, not to even, these are uninsured, that decide not to apply and not even to look into it. And 44% of those people are eligible for subsidies. So these are people that think it's too expensive, so they're not going in, and they're eligible for subsidies. So we want to look at that population, really see if we can get some media weight against those people, so that we can actually raise the awareness level among those. Now, the awareness level of subsidy eligible population is a little bit higher than overall, but it's still, there's room for growth there. And for them to know that they're likely to qualify for subsidies, feels really critical. So we looked at those people. The qualitative, I won't go into the detail of it because I take up all the time, but did personas of who those people are, that then we will be developing ads against. The ads, Abby folks, we just talked the other day, gave and about how who the ads they're developing for that, and going to that more straightforward approach that Russell referenced. Okay, I know I overstayed my welcome, Connie, sorry.
No, wonderful. Great job. Thank you, Peter.
Thank you.
As we discussed, we wanted to share an example of some of these special enrollment ads that are running right now. You'll see here that we have focused very much on the brand color palette. We have used the similar lines that we've used in previous years, such as plans change, we're here for you. We've very much highlighted, whether that's through text or photos, some of those qualifying life events. And then our call to action, you'll see on many of these advertisements, are plans as low as $10 through A/B testing on digital campaigns. During the open enrollment period, we found that more people clicked on plans as low as $10 than plans as low as $0. And that is supported by some national research as well. So that's what you will see in these special enrollment ads. And when we talk about the Medicaid renewal and the public health emergency unwinding, here's an example of a billboard ad that has been running in the off season right now. Again, you'll notice that if you remember our first phase of our Medicaid and public health emergency unwinding ads, we very much focused on encouraging people to look for their packets in the mail and to make sure that they were filling those out. As the unwinding has gone on for some time, we've kind of moved into what we're considering a phase 2, where we're focusing on, if you have lost Medicaid, Nevada HealthLink can be that partner that can help you find a health insurance plan. So you'll see that reiterated on our ads, and then additional updates we're doing to some of the website language as well.
I love these simple, straightforward bullet ads. Plans change, of course, as an OB, new baby, and lost Medicaid. That is, you know, it's so effective. It really grabs them. I think I always say you guys do a great job. It could be your best ever.
Thank you so much. When we're looking at billboards, especially, we're always trying to keep it under 8 or so words. It's very hard you would think it'd be easy to put, you know, a message into 8 words, but it's really not. So we're always trying to condense it as much as we can so that the information is getting across to our consumers when they need it and when they're seeing it. I want to talk a little bit more about our paid media strategy. As you know, year round, the Abbey Agency Nevada HealthLink team is doing paid media, social media, PR, and then content marketing. So that includes website updates, blogs, and newsletters to help reach our consumers and make sure we're providing them with the information they need when they need it. Paid media, of course, is an important part of that. We are looking to reach all uninsured Nevadans as we can through different targeting. We are looking at subgroups of our audience. So sometimes we're looking at subsidy eligible uninsured Nevadans. We're looking at rural Nevadans, our multicultural groups, and we're of course looking at the state as a whole. But we do deliver different ads based upon the urban markets and then rural markets. This is a picture that we actually took in September of last year in Fallon, Nevada. So it is something that is very, you know, aligns with the rural audience directly. So we're using pictures like this to reach our rural audiences. You'll see here an overview of the Medicaid unwinding and public health emergency strategy from a paid media perspective. I know this is lots of information. It is all in the board packet. I'll just share here at a highlighted level. We are doing advertising on Google search. So if you're on Google or Bing and you're searching, you know, what happens if I lose Medicaid, what's next after losing Medicaid in Nevada, things like that, you're going to be served ads. We also have Google Display, which are some of those square images that pop up when you're using the internet. We're serving videos on YouTube. We're doing Meta, which includes Facebook and Instagram, Spotify, and then out of home. So those billboard ads, which I just showed you a couple of slides ago. We are serving everything in English and Spanish. And then when anyone clicks on an ad and goes to the website, we are also retargeting them. If somebody clicks on the ad and goes to the site to learn more information, they probably have a reason why, whether that's themselves, looking for this or they know somebody. So we're going to retarget them with information. So far to date, looking at January through May, when this report was provided for the fiscal and operational. Again, this is a big data set here of each of the campaigns that are running. On the side here, we've provided some high-level insights and findings. Overall, I'll just touch on a couple of those. On Google, we had a click-through rate of 23.19%, meaning that when people were searching for this language, we were reaching them with those right keywords, and they found Nevada HealthLink to be a reputable, trustworthy source to come to, which is great. Overall, we were able to determine that we had more than 20,000 website visits directly from Google Display coming to the Nevada HealthLink site after seeing the PHE message. We had almost 1 million impressions on YouTube. On Facebook and Instagram, we were focusing on decreasing the cost per click while increasing the click-through rate. So we achieved both of those goals, which we like. And then I mentioned the out-of-home, but we placed the out-of-home in target zip codes where we know these individuals are most likely to be, whether that's living, working, commuting. So one thing we always kind of say is in Las Vegas, yes, a lot of people drive the 15, but that's not as targeted as some of the neighborhoods and some of the major cross sections with the 215. So we'll focus on out-of-home and billboards there versus the major 15 corridor.
That was a great Google click-through rate. Great job, and a great bringing down of the cost on your paid social media. Outstanding.
Thank you. We're always looking to bring down the cost while reaching the right individuals, so we can reach more of the right individuals. You'll see here that this report is provided for our special enrollment period. We obviously start the advertising for the special enrollment period after open enrollment. So these advertisements began on February 1st. We are running quite a bit of the same channels, Google search and display, the paid social media on Meta, YouTube, Spotify, and out of home. We very much look at our targeting efforts to make sure that we are not competing with ourselves on any of these advertising platforms. So we're always looking at who we're targeting. If we see any potential crossover, we'll change our targeting to ensure that the right people are seeing the right message. Again, quite a big data set here of how each of these are performing. Our Google SEM click-through rate for the SCP was even higher than PHE, which is great, and much higher than the industry standard overall. You'll see here that the Google display drove more clicks to the website than the PHE, which, you know, we're reaching a bit of a wider set of people who have more qualifying life events here. So that's not surprising to see. And then on Spotify, we had quite a few impressions and 1,000 clicks, which we were excited to see that as well. So overall, we believe that both of these paid media campaigns are delivering people, providing an overall awareness with those billboards, but then on the digital side, delivering the right message to the right people and then getting them to the website. Speaking of the website, we are here on the website. Over the past 6 months or so or 5 months or so since OEP has ended, we are constantly working on making sure that the website has the right information, it's easy to navigate, and is updated. So we've done certain things on the homepage just to consolidate the colors, so that if somebody's clicking on enroll now, that's always going to be a green button on the website. If they're looking to log in, that's always going to be a purple button. So we've done some improvements like that just for consistency's sake across the website. We're also working with the team to transition newsletters to find a system that works best for the exchanges team, as well as the Abbey agencies team, to deliver information to our consumers and our stakeholders.
I love the reduced clutter and the focus on the key elements. It's fantastic use of white space. So very much more readable.
Thank you. One important thing looking ahead is that, as you all are probably aware, or maybe you watch, there is always new regulations and or guidance about accessibility on websites. Nevada doesn't have a specific guideline yet on websites, but there is the Web Content Accessibility Guidelines, which is somewhat of a national standard that our team is always looking to. So over the next couple of months, we will be making sure that we're doing a little bit of a work and audit on our end to make sure that we are adhering with those accessibility guidelines. So those are things such as language, such as being able to have screen readers use the website. So some of it's front end and back end. The site already has much of the accessibility needs and requirements done, like alt tags on images and things like that. But we're going to be working to make sure that we're adhering to the highest standards possible.
When someone enrolls and actually enrolls, what's the average pages they need to do that?
That's a great question. We can get back to you. I think it's, I'll show you here on the next slide. This is a great setup, but in the past January 1st through May 10th, when we pulled this, you'll see we had over 500,000 web visitors, over 5 million page views, and then pages per session is 9.5. That's often what we see on aggregate, and that includes NevadaHealthLink.com and enrolled.NevadaHealthLink.com. So that is somebody who is looking at Nevada Health Link's pages as well as the enroll pages. I think that depending on a variety of your personal circumstances on the Get Insured enroll.NevadaHealthLink.com platform, you could see a varying number of pages. It's not the same for each person, but perhaps we can work with the Get Insured team to understand what the average is on their side and then kind of marry it with what we're seeing on the informational NevadaHealthLink.com side.
Thank you.
Absolutely. We wanted to report on blog and newsletters this year. So far, the blog has had over 300,000 views. That is helpful and important because the blog is searched by Google. So when people are looking for specific topics, the blog can help give them access to those specific pieces of information. You'll see here that these were the top performing blogs. The first one being the 8 Nevada health insurance providers offering the best health plans in the state. Knowing that this report includes that first or that last part of open enrollment, it makes sense that people were definitely looking for more information about carriers as they were making that final decision. Our newsletter, you'll see here, overall what was sent and open rate, as well as click-through rate. It's good to see the open rate go up. We did see the click-through rate go down. That's not necessarily surprising. More people are opening it, but they might just have the information they need and not need to click through. We definitely use the newsletter to deliver information. It's nice if people click through, but we don't want to almost jinx them into having to go to the website. So we try in the newsletters to deliver the information they need there versus making them jump through hoops to see it elsewhere. Now we're going to talk a little bit about the public relations efforts. So Owen, I will turn it over to you.
Thank you, Connie. Owen Truesdell for the record. Going to go through a little bit of our public relations and community engagement outreach efforts during the off-season campaign. Some of these have already been touched on by Janelle and Russell, but happy to go through some more detail on them. Couple key elements that we've been pushing out through the public relations channel as part of our overall strategy. One was a integration of a new AI chatbot that was brought forward by the partners at Get Insured. We did some both statewide outreach as well as national outreach in partnership with the Get Insured folks, really trying to emphasize this as another step that the exchange and Nevada Health Link is taking to meet people where they are and deliver support and service in the way that they need it. So we got some very, very interested media pickup and something that we expect to be kind of ongoing, especially since we were one of the kind of first movers in the nation on this, something that we expect there to be additional media coverage on going forward. As Russell mentioned, we did a press release announcing the SMS text campaign as a new outreach feature that Nevada Health Link would be conducting to reach that hard to reach audience of those who are not able to access their Medicaid coverage anymore. Really, our goal with that outreach was to balance the need for continued education around texting scams, something we know and have done a lot of public education around in the past. Now that we will be reaching out directly via text message, we wanted to use our earned media and public relations channel to tell folks, hey, this is something that is a legitimate outreach coming from Nevada HealthLink, the official marketplace, so that if people get a text and they're not 100% sure, they can maybe Google or search on Bing to see, hey, is this something that they're doing? And those news stories would pop up. Also, another way of trying to remind folks that they should be checking their coverage status to see if they have in fact lost access to Medicaid. And then lastly, again, as part of our ongoing efforts to make sure that we're bringing in more partners and doing community-based conversations. We have done 2 Facebook Live events over the past few months. One in March discussing the anniversary of the Affordable Care Act with Russell and Heather Korbulik from Get Insured, and obviously the past executive director of Nevada HealthLink. And then in May, talking about Women's Health Month with Rosa and Councilwoman Ruth Garcia Anderson. So just some of the things that we've been doing. For the public relations side, I will say we definitely ramped down a little bit of our public outreach during the non-open enrollment period, the off-season period, to give media a little bit of a break, since we do really push very aggressively during the run-up to and in open enrollment period. But we do really focus on our community relations efforts there. So as Janelle had mentioned, we attended 94 different events throughout the state, executed 44 activations and sponsorships, and had direct interactions from our navigators, reported at more than 10,000 conversations at these different events. Chairwoman?
Yeah. I just think it's very exciting trying new technology. We've always prided ourselves so much in the call center with the personal response, because we all know that although you can simplify the messages that you're advertising with, it's very complicated for patients negotiating their plan. And that's why we've made the brokers and everybody so available. So I'm sure that this, as you said, the benefits are great in that simple little things AI bot can take care of very easily. And then it allows the call center folks to deal with the more in-depth, complicated things. So I was just wondering, I'm going to definitely try it out. I haven't yet. And I'm hoping we don't lose that personal touch we work hard to achieve. So at some point, does it do like all the other automated things where it says, this is, we're going to have to turn you to an operator? Is that what it does?
That's my understanding, though I will admit that I will defer to the experts from the exchange staff to know exactly what the chatbot does and doesn't do. But my understanding is that yes, it does do kind of the basic functionality, and then as necessary pulls you into having those direct conversations.
Have you had any feedback from our customers yet on it?
Not that we have heard, but I would again defer to our
Okay.
folks at the exchange to
I'd
answer.
just be curious on the follow-up, but you can proceed. Thanks.
Absolutely. So some really high level results. We in the off-season period secured 83 media placements, including some one national reference from CNN, where they quoted Katie Charlson, kind of talking about the need for health insurance. Again, obviously, our primary focus is speaking to Nevadans, and so national media outreach is not our primary goal. I will say part of the reason we do that in targeted ways is to help improve our SEO score and make sure that Nevada HealthLink is ranking highly across when people are searching. And so that is the real goal of doing any national media outreach, is to bolster our SEO scores. And then, as we mentioned, placing an op-ed from Russell about the importance of healthcare and health insurance in conjunction with the ACA anniversary. If you want to hop to the next slide, we'll talk a little bit about community engagement. Again, we've gone through these numbers. I think the most important thing to really emphasize here is that we are constantly looking for new events and new places to interact with Nevadans in person, especially reaching diverse and multicultural communities throughout the state. And this is really a place where we, in addition to the Abby Agency and the Erica Avila's team, get lots and lots of suggestions from Nevada HealthLink staff, as well as our brokers and navigators, and work to make sure that we're showing up at the right places. And we continue to get really strong navigator reports back from the events that we do attend. And that, just again, for context, is kind of how we determine which events to continue attending, and maybe even up our engagement through sponsorship, is those navigator reports coming back saying, you know, these were really well attended, these events maybe not so, as they do kind of ebb and flow over time, especially as we really get into the full post-pandemic in-person landscape. All right, and then if you hop to the next slide, speak a little bit to the work that we do in partnership with Erica Avila's Consulting, making sure that we are reaching our multicultural communities. So there's a full report included, but a couple things we did want to highlight is those Facebook Live Spanish conversations. And in particular, I want to make sure we shout out Rosa and the On the Road with Rosa partnership that we did with RTC of Southern Nevada. Really appreciate Rosa kind of being the face of this campaign, and doing something that has multiple engagements. So there's the in-person element, there's the social media piece, and then the ongoing partnership where we provide branded water bottles. So those are being handed out over time. So thank you, Rosa, for doing that, and always being willing to be a spokesperson for Nevada HealthLink, in addition to Russell and Janelle and others.
Did the bottles say On the Road with Rosa?
I think these just had our branded logo on just the NevadaHealthLink.com. I think we didn't go too far that way, but we do have the social media segments out there and have more in the pipeline as well. Yeah, so that's a quick summary of our multicultural outreach, which continues throughout the off season. Thank you.
Go ahead, Dr. Jameson.
Oh, no, go ahead.
Okay. Moving on to social media. Our team remains working on posts, again, both in English and Spanish, for a variety of platforms, including Instagram, Facebook, Twitter, LinkedIn, and TikTok. We continually work to make sure that the content we're putting on each of those channels aligns with the audiences that are on those channels. So those who are on TikTok are younger. We're only post video content on that channel because that's really created for that. Whereas LinkedIn, we're often posting a bit more news-oriented content and information that aligns with a lot of our broker and navigator communities and other stakeholder communities. We are going to be working on this summer, working in more alignment with our community outreach, to be going to lots of these events and doing more story content on Instagram and Facebook, which shows real-time people and the brand in the field, so to speak. Overall, in looking at the engagement, posts with people in them do very well. So we want to make sure that we have more access to that. Overall, here are the results of social media, including total impressions, engagements, and audience growth in these past 5 months. And that concludes our presentation for today. We're happy to answer any questions.
Thank you. Does anyone have any questions? We have, we'll be done very shortly. We just have a few items.
Sorry,
yeah,
Madam
go
Chair,
ahead.
Tiffany Davis for the record. Apologies for the interruption. I do see Miss Elsie Lewis has her hand raised. She just was able to join us during the marketing.
Very good. Yes. Levon?
I think you're still muted.
I know. Sorry. I didn't hear an answer to your question regarding the artificial intelligence answering the calls from people and whether or not it then rolls over to a real person. I don't know how other people feel, but I hate getting those answers on, when I call to get some information. So does it roll over so that they get a real person? I don't think you ever got an answer to that.
I will turn that over to Russell to answer. The AI technology is fully implemented by the Get Insured and Exchange team. So our team provided a press release about it, but the Exchange team and Get Insured implemented so they can discuss the specifics.
Thank you, Connie. Russell Cook for the record, and thank you, Ms. Lewis, for the question and the opportunity to clarify. The AI technology serves as kind of almost like a front end or a welcome mat for the call center. Consumers reach the AI technology before they have the opportunity to reach a live agent. But the AI virtual agent, virtual assistant, as we call it, does provide a responsive way for consumers to get transferred to a live agent if they wish. It does gather some basic information from consumers in order to verify their identity and confirm whether or not they are existing enrollees of Nevada Health Link, or at least have an existing account through our website. And then that information is passed off to the call center, so that results in some time savings there. I'm right there with you. I really agree about the frustrating user experience of certain types of robotic technologies. I will say that in my personal opinion, I think that this technology is head and shoulders above past experience that I've had in recent years with other types of kind of pseudo artificial intelligence technology. It really is conversational in nature, and it really does, in my opinion, provide responsive transfer to live call center agents for a variety of consumer prompts. So general frustration, obviously, if a consumer specifically asked to be transferred to a call agent, these will tend to funnel consumers to live agents. I will say, though, the quantity of consumers who actually stick it out with this virtual agent and are able to have their issues resolved by the agent is not insignificant. So we are seeing a high degree of utilization of this service. And in particular, after business hours, every single call that the call center receives gets routed to this virtual agent. It's the only option when live agents are available. And we are consistently processing hundreds, at least, of calls each week for consumers who require assistance with password reset. Maybe they want to check the status of the documents that they have looked for verification, that sort of thing. So, and I'll close by saying that we do monitor the performance of this technology closely using post-call surveys. Not everybody opts into the surveys, but the ones that do generally get very high marks. And the performance of the AI agent is comparable to live agents, generally 90% or higher, on many weeks, 95% or higher.
Thank you.
I hope it's not higher than a live agent response. Thank you so much. It sounds like a win-win. So again, we should be wrapping it up shortly. We have a few possible action items, and then we'll be able to get some public comment and adjourn and let you enjoy the rest of your afternoon. The next item is the approval of the semi-annual fiscal operation report, much of which we've actually had seen a lot of what's on that report, discussed a lot of it in our meetings so far. So I would like to hear a motion. Oh, did you want to make any comments before we go on to call for a vote? As the executive director, did you want to make any comments about the approval, about the semi-annual fiscal report before I ask for the board? I am assuming, as always, that our board members have reviewed it. And after we make a motion, we can see if there's any discussions, and then we could vote. But did you, as executive director, want to say anything? I will say this much right now. You and your staff have done an incredible job, and our marketing, everyone, in creating a very great report for the governor. So thank you.
Thank you, Madam Chair. Russell Cook for the record. I do not have any comments about the report. I feel that it speaks for itself. Obviously, we've been very busy so far this year, but I would be more than happy to entertain any questions. I might have to defer to some of our other team members here on the exchange staff, but if there are no questions, my recommendation would be that we proceed with the
Okay, let me go ahead and ask if we have a motion for approval of the semi-annual fiscal and operational report pursuant the NRS 1 to the governor and legislature.
This is Quincy Branch for the record, so moved.
Do I hear a second?
Valerie Clark, second.
And are there any questions, comments, or concerns before we call for the vote? Any hands up? Hearing nothing and no one seeing hands. Everybody in favor, you may say aye. Aye. Anyone oppose? Any abstaining? The motion is passed unanimously. Next for possible action. Oh, yeah.
Sorry, Madam Chair, just for the record, I just wanted to state that at one point we did have 6 voting members. I think one of our members, Anna Torres, I don't see her any longer on the list of attendees. So I just want to make a note of that currently we do have a quorum still.
Yes.
The five members. So just so that's on record for those in cases.
Excellent, excellent. And thank you, Ms. Lewis, for joining us and keeping our quorum there. Thank you so much. So the next item, possible action, proposal of the final language of the language access plan for implementation related to the NRS 232.00. Sorry about that. 8.1, and it's taking in consideration the public comments that we all heard earlier. And so does someone want to make a motion? I apologize again.
Madam Chair, Russell Cook for the record. I would be more than happy to read a brief introduction that we have prepared to the language access plan as a supplement to the plan itself, but we're more than happy in the interest of time to allow the board to proceed with the vote if so moved.
I think that you could probably do that paragraph because it's beautiful about how automatically they'll get English and Spanish, but it can also do 100 other languages or something. You want to do that?
Well, I wasn't going to endeavor to read the language access plan itself, only the introduction to it. And there's a little bit more detailed information about the workshops before we wrap with the section Title 4 board consideration and approval. Again, I know it's been a long meeting thus far. More than happy to proceed with the vote. I just wanted to offer to provide that brief bit of context for the board if the board thinks that would
the board like to hear that? Are we ready to just proceed with okay, so do I hear a motion?
Jonathan Johnson, motion to approve.
And a second?
Second the motion. Levon Lewis for the record.
Thank you. So any questions, concerns? If not, we'll go ahead and take a vote, and everybody that is in favor of passing this motion, proposed final language of the language access plan for implementation related to the NRS 232.0081, please say aye. Aye.
Aye.
Aye.
Hands are all up. Any opposition? Any abstinence? It is unanimously approved by the board. Possible action, next item, the memo of understanding between the Division of Insurance and the Silver State Insurance Agency. The memo of understanding outlines the responsibility of each agency. I have reviewed it, and I assume again all of our board members have reviewed it. I was thinking perhaps here before we take a vote, Scott Kipper might have his input since we have him present, and or any other input is always welcome.
Thank you, Dr. Jameson. For the record, Scott Kipper. And I think you've nailed it. This MOU is pretty straightforward. It has been revised before. The revisions in front of you today just more reflect the issues around plan management and the obligations under statute for the Division of Insurance. But certainly, I really appreciate the opportunity to lay out the collaborative efforts between the exchange staff and leadership and the Division of Insurance. And again, I think the document speaks for itself. With the addition of the piece around the tribal responsibilities and also around defrail are new, but I do believe that they really very much quantify the work that both agencies are doing. So with that, Madam Chair, I would turn it back over to you.
I had one question on the defrayal, since it won't go to the carrier and it doesn't go to you. And does that mean the state will pay it? I mean, is that how it works?
Well, yeah, I've got one of my experts on the line, but I will take a shot at that. The defrayal, it does go from the state to the carriers. So the exchange doesn't have the money, the division doesn't get the money, it does go to the carriers.
Okay. That was I wasn't sure. Thank you so much. Okay, in that case, I think we're ready to proceed with the vote on the MOU, Memo of Understanding between the Division of Insurance and the Silver State Health Insurance Exchange. All those in favor say aye.
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 Any opposed? Any abstaining? The motion is passed unanimously, and it was very exciting, as you said, to have also included on there the tribal group included. And then finally, possible actions. I think our staff has been probably writing down everything about the VSP and the a process for creating a policy for reviewing people we endorse. Our AI chat dot follow up on how it is our customers are liking this new artificial intelligence, although we had a good glimpse at that from Russell's comments, final comments. But were there any other items that you board members would like to have follow up next time?
Jonathan Johnson, just as it relates to the public health option, and what happens at the end of the month with the injunction.
Excellent. Yes. Thank you for remembering that. We are so excited to hear about the public health option follow-up as well as the VCI cost.
Can I ask that I present that to the board just because I think we can have a conversation? Can you hear that? Okay.
Yes. Yes. That would be wonderful.
I would appreciate that because that is what I typically do for committees that invite us to come present on an update. I cannot speak to the litigation. That is still confidential. And ongoing.
Yes, we would love your expertise on this issue.
Okay.
Thank you so much for
thanks.
volunteering. All right, I think we'll have a very busy agenda for the next time. I will just say this approximate 10 years I've been on the board has been an absolute pleasure. And I look forward to new adventures in the next legislative session because we physicians want to do a lot of other things to make access to quality healthcare better in this state. So I can't thank you enough for the honor of being a board member and a chair. And at this point, I will just say, wishing you long and healthy, happy, joyful life. And I hope to run into you here and there, all of you. Thank you so much. The meeting, we're first going to say public comment, and then we'll be ready to adjourn.
Madam Chair, Tiffany Davis for the record. I am happy to go ahead and help facilitate the public comment. I would like to make mention that just one more brief as far as the next meeting date. Right now it is set for October 15th at 2024 at 1:30, unless the board determines that there is another meeting time before that they would like to have another one before that date. For public comment, again, for those who have joined us online, if you would like to raise your electronic hand feature and indicate in the chat box if you would like to make a public comment, Caitlin Blagan will call on you and allow you to unmute yourself. And I'll start with our Carson City Conference Room. Cassie, do we have anyone in our physical location there in the conference room that would like to make a public comment?
Cassie Fuentes for the record. There are no public comments here in the Carson City office. Thank you.
Thank you for that verification. And then online, once again, if you would like to provide public comment, you can raise your electronic hand feature on Zoom now, and Caitlin will call your name and you may unmute yourself for public comment. Do we have any public comment at this time from anyone who has joined us on Zoom?
Caitlin Blagan for the record. I do not see any hands raised or anything in the comment box.
Okay, wonderful. Thank you for that verification, Caitlin. And then on the phone lines, I know a couple of people have called in. Is there anyone who has joined us by calling in that would like to go ahead and make a public comment? You may now unmute yourself and present your public comment. Not hearing anything. Just to verify, Caitlin, do you see anybody from the phone lines?
No, but it looks like Quincy Branch might have had his hand raised.
Yes.
Quincy.
Okay. No, I did. Again, I just wanted to make sure. And again, more so just a public comment, but just more so a public just thank you. As a fellow board member, I know my tenure has not been as long as Dr. Jameson, but just really do appreciate her time, her attention, and her diligence and the time I've been on the board. And I know a lot of things that she's done, people don't see. So Dr. Jameson, just want to say thank you again for your time and attention and your talents on this board. So appreciate it.
Thank you.
Well, thank you so much, Quincy. And Dr. Jameson, at this time, it does not sound like we have any further public comment, but you do have several messages in the chat that are expressing a big thank you to you and your service here at the Exchange.
And again, once again, thank you all and have a wonderful day. And I will take a motion for adjournment. And seconded.
Second.
And shall we all adjourn then? Thank you so much, everybody.
Thanks, everyone.
Ta-ta for now. Thank you.